My favorite opera, I would say, continues to be a Bohème by Giacomo Puccini. And, Bohème tells a story of tuberculosis and tells a story of love and relationships and death and the disease, tuberculosis. And I'm really, particularly proud that together with the Atlanta Opera recently, we did something in which we took Bohème and actually, instead of starting in Paris in December of 1830, it starts in New York in December of 2019. You can use the exact same story, the exact same music, but change the disease, and it's incredibly relevant still.
Well, I arrived at Grady at the end of 2011, and one of the very first people I met was Dr. Carlos Del Rio. He is a national and international legend in HIV and AIDS research and other infectious diseases.
Carlos's impact on healthcare, I think I would have to say game changer globally.
Quite frankly, he rescues people. Carlos has always worked toward helping those who are often stigmatized and left behind.
The way that he has managed his research, the way that he has translated research into care, and the way that he has helped to educate the rank and file of folks who give care has been a game changer.
He's worked for minority patients, those with substance abuse, those with HIV, and those with other social determinants of health. His work made these issues apparent and challenged the medical system to solve them long before healthcare disparities were important topics on everyone's minds.
To me, the fact that there's patients in Mexico that still follow him is impressive.
Watching him do that with other infectious diseases as well as healthcare in general has all taken the same pattern. He solves problems and he helps people take care of patients.
Well, I initially came to Emory first as a visiting medical student, and then I decided to come here for residency, in great part because I wanted to be a cardiologist, and I wanted to work under J. Willis Hurst, who then was the chair of the Department of Medicine and a world-famous cardiologist. And when I got here in 1983, was also the beginning of the HIV epidemic. There were many young people, many that looked like me, who came in with this horrible illness, who would die. And there was a personal connection there, but there was also the science, right? The discovery, all the different things that was coming out in the papers, that was coming out in the literature.
Carlos is an incredibly inquisitive physician who is one of the first people to be on the front line of a new pandemic to figure out how to take care of it, how to get a vaccine for it, how to make it better, how to take care of patients.
I tell people that in infectious disease, we go from AIDS to Zika, right? From A to Z. And there's something new that has emerged and that is challenging us on a continuous basis. Some years ago, we had here at Emory Ebola, and then we had, influenza, and then we have COVID, and then we have HIV, and then we have Mpox, and then we have this. And, every time there's something that is challenging you, it has to make you think in a different way. And infectious disease brings, again, something that I like, which is that individual care with population care. You can do interventions at the population level and at the individual level in ways that sometimes it's hard to do in other diseases.
He and I both lived through the era where we were providing care to HIV and AIDS patients. The few that did survive are miraculous. He was there taking care of people. And there were a lot of physicians who wouldn't even go near an HIV unit. They were so afraid of it. But then all of a sudden in the mid-90s, Carlos was on the front line of developing pharmaceuticals and treatments that actually ended up turning AIDS into a chronic disease and not a death sentence.
Throughout my career, I have had the opportunity to collaborate with WHO, with CDC, with UNAIDS, which is the United Nations AIDS program, now with the National Academy of Medicine, where I serve as the International Secretary. So a lot of what happens in infectious disease has to be global. You have to have a global perspective. You develop collaborations around the world, you develop friendships, you have impact on people in other places, and you really can transform what happens in health in other places.
Carlos was doing global health work as well for Emory through the School of Public Health. And so he was all over the world, not afraid to face Ebola and other things in other countries, but representing Emory University, Emory School of Medicine on an international basis. Fast forward several years, and he decided to become the Associate Dean for the School of Medicine at Emory at Grady. and became an incredible partner to the administrative staff in his liaison role. Now, he's taken on the chair of medicine role.
There's a lot of ways that you can impact students and trainees. I think the most important one is mentoring. A lot of it is very serendipitous. You help develop people and you help people find their path and find their career. It's something that I particularly enjoy. There's nothing that makes you happier than to see one of your mentees be successful.
So Dr. Del Rio, or Carlos, has been my teacher, my career mentor, and he's someone who I certainly consider now to be my friend. I remember when I first rounded with him as a first-year fellow at Emory University Hospital. We were on the infectious diseases consult service, so I would go see patients, gather all the information, and present them to him. And I'll be honest, at first I was a little annoyed because I thought he wasn't paying attention to my carefully prepared presentations on our patients. Instead, he was typing away on a computer and sometimes not even looking at me. However, I quickly learned that he had superhuman multitasking abilities and had somehow heard every word I said and also searched the scientific literature for the topic of my presentation during my presentation. He absolutely loves medicine and he loves to learn. His enthusiasm and energy for cool cases or a quick impromptu trip to the microbiology lab never waned.
To be passionate about what you do, to be inquisitive, there's always an opportunity to learn new things. And one thing about medicine is we're always continuously learning. There's a lot of new discoveries happening on a daily basis. You will make mistakes, you will miss things. And I think one thing that you learn in medicine is the importance of being humble.
At his core, Carlos loves connecting people with each other and with opportunities.
What I can tell you about Carlos is that he cares. He's passionate and he cares whether they be a patient, a learner or a trainee, or a colleague. He will get right down to the details, face to face with someone who needs him. And then he will flip it into a leadership directive. We're going to do this now because I've seen what the individuals need. And there are not a lot of people who know how to do that. He's wonderful at that.
I think at the end of the day, when you think about medicine, we have more technology, we have more tools, but at the end of the day, is that doctor-patient relationship, that talking to the patient, that examining the patient, that communication that you need to have with the patient, that hasn't changed, right? That continues to be the most important part of the healing process.
Carlos, muchas felicidades.
Thank you. So I think clearly Jeanette has been an important integral part of my life and a very important part of my success. I could not see myself being where I am without having her at my side as a partner, as a collaborator, as a colleague, and as a friend.
He's a very caring man. For me, he's always been a partner, whether it's been in medical school or writing a paper or, taking care of the kids.
And clearly the sum of us is much better than the individual parts, and you can achieve a lot more if you're working together. And if that partner, that colleague also happens to be your wife, it's even more successful.